Welcome to the Mula kay Doktora,
Recording
the
in
Dr.
progress.
Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Pi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched news set on getting your COVID-19 shots for Viber, and at tinyurl.com/immunity-tg for Telegram. currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and you may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber and at tinyurl.com/immunity-tg for Telegram.
Orasyo Imperata para sa proteksyon laban sa COVID-19 virus. Mahabagin at mapagmahal na Ama, nagsusumamo kami sa iyo upang hilingin ang iyong patnubay laban sa COVID-19 na nagpapahirap sa marami at kumitil na ng mga buhay. Tunghayan mo kami ng may pagmamahal at ipagadya kami ng inyong mapaghilom na kamay mula sa takot sa kamatayan at karamdaman. Itaguyod mo kami sa pag-asa at patatagin sa pananampalataya. Gabayan mo ang mga dalubhasang naatasan na tumuklas ng mga lunas at paraan upang ihinto ang paglaganap nito. Nagpapasalamat kami sa mga bakunang naisulong sa patnubay ng iyong mga kamay. Pagpalain mo ang aming mga pagsisikap na mawakasan ng mga bakuna ang pandemya sa aming bayan. Patnubayan mo ang mga lumilingap sa may sakit upang ang kanilang pagkalinga ay malaki pa ng husay at malasakit. Pagkalooban mo sila ng kalusugan sa isip at katawan, katatagan sa kanilang paninindigang maglingkod at ipagsanggalang sa karamdaman. Itinataas namin ang mga nagdurusa. Makamtan nawa nila ang mabuting kalusugan. Lingapin mo rin ang mga kumakalinga sa kanila. Pagkamitin mo ng kapayapaang walang hanggan ang mga pumanaw na. Pagkalooban mo kami ng biyaya na magtulong-tulong tungo sa ikabubuti ng lahat. Pukawin sa amin ang pagmamalasakit sa mga nangangailangan. Sa pagdamay at malasakit namin sa bawat isa, malampasan nawa namin ang krisis na ito at lumago sa kabanalan at pagbabalik loob sa iyo. Hinihiling namin ito sa pamamagitan ni Hesukristo na nabubuhay at naghaharing kasama mo at ng Espiritu Santo, Diyos magpasawalang hanggan. Amen. Dumudulog kami sa iyong patnubay, mahal na Ina ng Diyos. Pakinggan mo ang aming mga kahilingan sa aming pangangailangan at ipag-adya mo kami sa lahat ng kasamaan, maluwalhati at pinagbalang Birhen. Amen. Mahal na Birhen, mapagpagaling sa may sakit, ipanalangin mo kami. San Jose, ipanalangin mo kami. San Rafael Arcangel, ipanalangin mo kami. San Roque, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream. The title of this forum is A Woman's Vaccination Tracker, Bakuna para sa Kababaihan. Today's forum aims to give us insights on the benefits and common myths of immunization in the female population. For today's forum, we have Dr. Maria Angela S. Rodriguez Bandola, an obstetrician and gynecologist, an infectious disease specialist, and a clinical associate professor of the Department of Obstetrics and Gynecology of the UP College of Medicine, as our reactor.
A pleasant afternoon to all and welcome again to the MUla kay Doktora, the Dr. Julita Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Sorority, the Mu Sigma Phi Foundation, the UP College of Medicine, the Philippine General Hospital, and the City of Manila. Now, this forum is a series of panel discussions that aims to discuss common concerns of women from all ages and walks of life. And today, we are already on the 13th leg of the year-round webinar series. For any questions for our speakers later, you may type them into the Q&A boxes of the UP Manila live stream and Zoom, or the chat boxes of FB Live and YouTube. Our forum today will tackle immunization among the female population. Today, we'll discuss the benefits of immunization and address some common myths associated with it. We'll also give a general overview of vaccination requirements among pregnant individuals, and I'm sure that we will all have an interesting afternoon. To formally start our forum, I'm honored to introduce our speakers. Here with us today are respected and well-known infectious disease specialists in their respective fields. We have with us Dr. Regina Berba, an internist, and Dr.Sybil Bravo, an obstetrician gynecologist. Our first speaker is Dr. Regina Pascua-Berba. She's an esteemed alumna of the UP College of Medicine, class 1987. Currently, she's been an active resource person on topics related to the COVID-19 pandemic. And due to her numerous contributions, she was hailed as one of 2022's Asia's People of the Year. To introduce her more, Dr. Berba is actually the chair of the Hospital Infection Control Unit and a committee member of the COVID Crisis Committee of the Philippine General Hospital. Moreover, she also serves as section head of infectious disease in the medical city. Beyond her numerous roles as clinician, Dr. Berba is also Professor 1 in the UP College of Medicine, Department of Internal Medicine, Infectious Disease Unit. So let's everyone please welcome Dr. Regina Berba of the Mu Sigma Phi Sorority Batch 1987.
Hello, good afternoon, everybody. So let me share my slides first. Yan. Okay. So I'll be speaking both in a little bit in Filipino and in English para mabilis lang tayo. So we entitled this series as A Woman's Vaccination Tracker, Gabay sa Bakuna para sa Kababaihan. And sa slide, I said, an ounce of prevention is worth a pound of cure. Ano ba ibig sabihin nun? Parang the small investment on all of these vaccines will considerably translate to maraming benefits. Okay. So we're really proud of this in the Mu Sigma Phi sorority. This immunity program has been going on for several years, decades na nga po yata eh. Turok-purok para bumalik ang tiwala sa bakuna. And kailangan we need to remember that everyone, lahat tayo, kailangan magpabakuna in different phases of our lives, no? So, nung yung mga anak natin dapat mabakunahan, pag nag-aaral na tayo, dapat may mga bakuna, hanggang sa maging young, teenagers to young adults, to mommies, at saka to when we become lolas, no? Kailangan we continue to take care of ourselves. So whether you're a student, you really need to think about investing on vaccines and protecting yourselves, pangalagaan natin ang ating mga sarili. kung naman dumating na tayo sa point na meron tayo mga family members na women, vulnerable women, yung mga elderly, and even our neighbors, other community members, our friends, yan, we also need to remind them and help them protect themselves and our community. So ano ba tong immunity na to? Ito ay estado or state kung saan ang katawan natin ay may sapat na depensa para makalaban sa mga nakakahawang sakit mula sa mga mikrobyo. So infectious diseases. So ito talaga yung linya namin. And yung bakuna or vaccines are one of the most powerful strategies for public health. Yung bakuna or yung vaccine ay naglalaman ng mga sangkap na kadalasan ay mula sa pinahina or attenuated or pinatay na mikrobyo at ginigising nito yung immune system ng ating katawan para sa ganun kung dumating yung pagkakataon na nandyan na talaga yung mikrobyo ay kaya natin siya labanan. Bakit mahalaga magpabakuna? So, ito yung mga benefits. No? Ito ay proteksyon laban sa mga nakakamatay at nakakahawang sakit. Ang mga bakuna, by the time i-market sila or maging available, ay ligtas. Sila ay napatunayang ligtas dahil sa mga pag-aaral. At ito ay epektibo upang maiwasan ang mga komplikasyon na dulot ng sakit. So hindi lang yung sakit itself like COVID-19, di ba? It's also yung complications dulot nitong mga sakit na to. At of course, ito ay iwas sa dagdag gasto sa pera at oras dala ng mga nakakahawang sakit or mga komplikasyon. So yun nga, an ounce of prevention. Konti lang yung investment pero ang daming benefits. And this is why yung aming grupo na Mu Sigma Phi Sorority, nag-continue siya, naging yung aming advocacy pre-COVID na tuloy through the COVID pandemic. No? We believe in the vaccines, we believe in the pre-pandemic vaccines and also in the COVID-19 vaccines. So we have to believe, sorry, balik ng konti. We have to believe that vaccines work. No? So hindi lang to sa Pilipinas, pero ito ay pinaniniwalaan ng buong mundo, lahat ng mga experts and backed by science. So yung benefits niya, hindi lang to nagta-translate sa mga number of infections na naiiwasan, pero yung mga lives na papanatili natin, lives saved, no? And of course, it also translates to a lot of economic benefits. Kasi nga, maraming naiiwasang sakit, maraming savings on an individual level, family level, and of course, on a country level. Iba-ibang klaseng bakuna have been seen to really save lives. No? So, tapos, last century, ito ang nahirang na number one of the greatest public health achievements. So sa lahat ng mga ginagawa ng maraming governments, it's really vaccine na pinaka-best return for every penny or every centavo used. And in fact, immunization has saved more lives in the world in the last 50 years than any other health intervention. And if you have parang limited resources, ito daw ang pinaka-most cost-effective health investment for public health. So, merong once upon a time, may ganitong sakit na very disfiguring. No? Pag nagkaroon ka nito, siguradong mamamatay ka na. And it's called smallpox. Pero most of us, hindi na natin to nakita kami, infectious disease, hindi na namin to nakita, babasa na lang namin to sa mga libro. So there was a time smallpox was a threat na kung medyo nandyan sa baryo nyo o barangay or city, parang di ka pupunta doon kasi it was really so highly infectious and so disfiguring. Ayaw mo talaga magkaroon nun just like what we are in right now. Pero in 1980, this smallpox was actually eradicated kasi may nakaimbento ng vaccine. So very soon after that was inoculated in many parts of the world. The WHO actually declared na smallpox is dead. So di ba parang ang ganda-ganda ng mga pangyayari. So ngayon nandun tayo sa same, very similar situation, no? Sa pandemya tayo, tapos over the last 2 years, parang 2 million na, 6 million, sorry, 6 million, over 6 million people have actually died. And hundreds of millions of people have actually contracted the illness. Tapos meron pang mga variants of concern. It almost feels like the world really closed, diba? Pero we'd like to think na meron tayong hope at parang malapit na nga to na the pandemic will someday go away. So that coming very, very soon, I hope, especially for the Philippines, back to normal na tayo talaga in a really good way. Okay? At paano tayo makakarating doon? The answer is more and more of us really need to be vaccinated. Kailangan tayo talaga magpabakuna. At kung meron pang agam-agam sa atin, kung kailangan ba natin talaga magpabakuna, the answer is yes. At ngayon, hindi lang 2 doses ang nire-recommend. 2 doses for the 2 series vaccines plus a booster. Ang tawag na CDC dito ay up to date. So, hindi ka lang fully vaccinated, kailangan ikaw ay up to date with the booster. So, meron tinatawag yung Philippines through the Philippine Society of Microbiology and Infectious Disease na vaccine tracker. So, tinutulungan nila tayo dito sa mag-decide. Pero usually, hindi na rin natin decision to, di ba? Kung ano available, yun na yung kunin natin. Tapos, there's this threat pa rin around the world kasi sabi nga nila, hindi naman the Philippines is an island on itself. We're just really part of a big global community. So kung ano yung nangyayari on other countries, pwede mangyari sa atin. So we really need to, parang kahit feeling natin tapos na or patapos na yung pandemic, need to still be aware and follow the recommendations. So kung sinabing booster, tayo lahat ay magpa-booster. Noong 2021, kung hindi pa po kayo nagpa-booster nung time na yon, dapat nagpapa-booster na tayo ngayon 2022. Lalo na kung tayo ay mga women na elderly, merong ibang karamdaman, and all others, no? Tapos merong fina-follow na ano ba yung magandang booster kung ito yung na-receive natin na primary series. Primary series means ito yung unang na-receive natin, usually dose 1 and dose 2 for most of the vaccine except yung sa Janssen. Tapos may nire-recommend silang booster kung gusto mong heterologous, so iba naman, or kung marami tayong naging side effects or potential side effects to stay with the same vaccine, so homologous. Okay? So, tapos meron pa nga yung mga sobrang mahina yung katawan. So, yung kung mga mommy natin, tita, mga lola, belongs to this category, talagang it's good to have more vaccines received over the primary series. Okay? Tapos on top of all of this, tandaan natin na meron pa ring mga bakuna sa kababaihan beyond the COVID-19 vaccines. Hindi lang, no? Minsan, pag bumibisita po yung mga pasyente sa clinic, sasabihin ko, sige, rest muna kayo kasi marami na kayong COVID-19 vaccines. Pero panay ko pinapaalala sa kanila na meron pa ring mga ibang bakunang kailangan. Okay, so tandaan natin, di ba, meron yung against chickenpox or varicella. Ayan, ito yung sa ibang dialect, sulalob yung tawag sa kanya. Okay, bulutong tubig reduces the risk for infection. Tapos, meron din actually parang kamag-anak to ng bulutong tubig, no? Herpes zoster, or in layman, sinasabi nila shingles, or in Filipino, tawag nila ticos. Okay? So, masakit na masakit to. So, pag 50 and above, parang or meron kayong ibang karamdaman na napapahina yung immune system nyo, magandang magkaroon kayo ng shingles vaccine. Tapos po yung isang medyo parang minsan nakakalimutan natin, meron pa rin mga bata at pati mga adults na nagkakaroon ng diphtheria. Usually to yung masakit yung lalamunan, nagkakaroon sila ng puti na infectious membrane dito sa lalamunan. Pag hindi nagamot, nakakamatay po ito eh. Tapos of course yung tetano, 'di ba? Minsan nakakalimutan rin natin. Tapos pag nagkasugat tayo sa emergency room, tayo pumunta, nabibigyan tayo ng booster ng tetano. For some of us, baka hindi pa tayo nabakunahan ng hepatitis, pero usually medyo strong na yung program for hepatitis B vaccination. Pero just that you know, pwede tayo makaiwas sa hepatitis B at even sa cancer of the liver sa pamamagitan ng hepatitis B vaccine na 3 doses. May HPV na pag-uusapan po ng ating next speaker. At of course, yung itong last two ang medyo parang pinakamahalaga, lalo na po kung kayo ay mga women, adult, immunocompetent, ibig sabihin lahat tayo. The recommendation for influenza or laban sa trangkaso ay that ma-receive na natin. Nilista ko po dito kasi minsan pagka nasa clinic na ko-confuse po yung ibang mga pasyente, sinasabi nila, doktora, may sakit ako kaya hindi ako pwede magpa-flu shot. Pero actually, yun nga exactly yung recommendation. Pag ikaw ay sa lahat na adult na tinatawag immunocompetent, malakas, dapat taon-taon. Pero on top of that, yung mga elderly, yan, in-underline ko, elderly, yung may mga cancer, yung may mga HIV, yung mga may COPD, sakit sa baga, sakit sa puso, lahat po yan nire-recommend natin. Yung mga strong recommendations to receive your annual flu shot. Usually yung flu shot, lumalabas na po yan ng mga April hanggang May. Tapos pwede po natin sila ibigay for that year hanggang mga November. So let's remember to go to our doctors for the flu shot. Tapos of course yung mga medyo may edad, baka dapat tandaan natin na pwede tayong magka-pneumonia, ng mga common pneumonia. So na later on baka maging cause na magpunta tayo sa respiratory failure. Nanghihina talaga yung ating baga, hindi na makahinga para sa inyo. So, yung pneumonia vaccines have been seen to really save lives, no? So, itong graph na to pinapakita na talagang the deaths related to the survival curves are really distinctly beneficial po for the pneumonia vaccines. So, ito po yung parang ginawa kong tracker, pero papakita sa inyo later yung MU tracker. So, yung tetanus, diphtheria, pertussis, dapat nagkaka-booster po tayo every 10 years. So, kahit adults na tayo every 10 years. Yung hepatitis B, dapat naka-receive po tayo in our lives. No? Kung na-receive nyo na to as a child, okay na. Yung influenza, every year. Yung shingles, 1 dose lang to. Pag 50 and above na tayo. At yung pneumonia vaccine, may dalawang klase kaya minsan nakakalito to. Recommended po pareho. I put another slide here. Kasi parang maraming iba-ibang combinations, iba-ibang mga doktor na ginagawa. Pero lahat po sila ay tama. Basta makareceive kayo ng isang yung tinatawag na lifetime. Tapos yung dating every 5 years yung pneumonia 23. Ngayon po, pag na-receive mo sila pareho, pwede nang hindi mag-redose. No? Okay. Tapos kung gusto nyo pa ng a little bit more detail, pwede kayo pumunta sa CDC website which tries to show here yung mga yellow, yung required, yung purple, pwedeng isipin pa kung kailangan. So, yan. So, just that you know, if you type CDC vaccination recommendations, dadating po kayo sa page na to na nakakatulong naman. And make sure na okay kayo dun sa mga naka-yellow, no? Okay. Frequently asked questions, mabilis na lang po ako. Tinatanong dito, are vaccines safe? Kasi minsan may mga news na kung ano-ano yung side effects, di ba? So, ang sagot ay yes. Dun sa specific question na autism, parang wala talagang scientific evidence proving that it causes autism. Haka-haka. So, it's safe. Minsan talaga, nagkakaroon talaga ng side effects yung vaccine. So, parang natitrigger kasi talaga yung immune system natin. So, sometimes parang sinasabi nila flu-like. Pero, hindi ibig sabihin nito ay dapat iwasan na natin ito. At magpatulong tayo sa ating mga doktor para mag-guide tayo, kunyari dun sa COVID-19 vaccines, kung ano yung pinakamahusay para sa inyo. Yan. So, yung question na, pag nagkukos ba ng flu-like illness, ibig sabihin ba masama yun? So, hindi. Yun ay parang natural na reaction ng ating katawan. And we still say na ligtas magpabakuna. At minsan, itong mga reaction na to ay very transient, sandali lang, at mild banayan. Tapos may mga nagsasabi yung, ay hindi na lang ako magpapabakuna kasi hindi natural yun. Instead, ako ay magpapa-infect na lang naturally, no? Meron nga po ako narinig na isang tatay na parang nung nagka-COVID siya, hinawa niya daw talaga yung mga anak niya para naturally magkaroon ng immunity. So parang ito naman ay hindi tamang belief or pag-iisip, no? Try natin wag gawin yun kasi minsan di natin alam where the infection will go. While most of the Omicrons, for example, were very mild, meron pa rin kaming mga pasyente sa PGH na nagkamatayan dahil sa Omicron COVID-19. So, wag natin daanin dito sa ganitong, for me, threatening or dangerous track, no? So, let's follow yung magpabakuna kasi mas ligtas yun. Okay? Tapos, yung tanong na, sapat na ba na naliligo ako araw-araw at saka kumakain ako ng gulay bilang proteksyon sa mga nakakahawang sakit? Pwede na ba yun? So, of course, sabi natin, okay yun pag naliligo tayo araw-araw, kumakain tayo ng sapat na gulay, pero baka kulang pa rin, lalo na kung tayo ay mas matanda na, mga mami natin, mga lola natin, kailangan na talaga ng tulong ng mga bakuna na papalakasin ang ating immune system. Okay? Bakit mabuting bakunahan ang ating buong pamilya? So ito na po yung concept ng herd immunity na parang pag mas marami tayo, mas maganda, mas may protection. And in fact, matutulungan na natin yung ibang hindi talaga pwede magpabakuna, no? So, anong maganda mangyayari kung lahat tayo ay magpapabakuna? So, look at it this way. So, yung mga may sakit, yun yung red. Yung mga blue, yun yung wala pang immunity. So, kung lahat tayo wala tayong vaccination, tapos nakapasok sa ating community yung mga red na infected, in time, lahat tayo magiging red. Lahat tayo may infect. Kung konti lang sa atin, yun yung yellow, nagpabakuna, so may some immunity. Kung meron pa rin kahit dalawa lang na red na pumasok sa ating community, sa ating grupo. Let's say sa office, yan. Konti pa lang yung nagpabakuna. In time, lahat ng tao sa office na yan may infect. Ngunit kung marami ang magpapabakuna, magiging immune, kahit marami rin na red na pumasok, may maintain. Hindi magkakasakit yung mga blue, no? In fact, mapoprotect po. So yan yung concept ng herd immunity na proprotektahan natin yung ating mga kasamahan na talagang merong bawal sa kanila magpabakuna. Or yung mga baby na hindi pa pwede bakunahan, yung mga kabataan. So may tinatawag yung ating government na immunization support, yung EPI, para makabigay ng libreng bakuna. At saka yung COVID-19, libre yan lahat. Bakit magandang bakunahan ang mga matatanda? Kasi talaga po na humihina ang ating immune system sa paglipas ng panahon. If I was vaccinated before and got vaccinated again, will I overdose? Kunyari po, yung tetanus, di ba sabi ko kanina, every 10 years, tapos hindi nyo na maalala. Paano po yun kung sa ER ako, nakagat po ako or nasugat ako, kasi iba yung nakagat ng aso. Nasugat ako, kailangan ko ng tetanus vaccine, pero hindi ko na maalala kung nabakunahan na ako. So, ang sagot doon ay no, wala namang overdose sa vaccine. Di ba nga, meron tayong mga kasamahan na ilang beses na na-booster sa COVID-19. So, basta hindi kayo nagkaka-reaction, okay lang. Can I get different vaccines be given to me at the same time? So, wala akong oras, nasa office ako. Most of the time, many vaccines, di ba yung mga babies natin, pwede mabakunahan several times. Pero tanongin niyo yung doctor kung ano yung pwedeng isabay-sabay. And what if I miss a dose? Paano kung nakalimutan ko na talaga? So in general, pwedeng humabol, no? Kung may ma-miss na dose, pwedeng humabol. Okay. Tutulungan kayo ng inyong physician para mag-make ng good decision. So, gusto ko pong paalala sa inyo and really encourage and convince you all to really take care of our vulnerable nanays and lolas. We love them. We need to protect them. And yun. Thank you very much po.
Thank you, Dr. Nina Berba. Always very comprehensive and compelling talk from you. No? Indeed, vaccination truly has its benefits and should be prioritized in achieving optimum health. So for our viewers, please feel free to put in your questions in the Q&A box. We will proceed with our next speaker. Our second speaker is Dr.Sybil LIzanne Reyes Bravo. She's an alumna of the UP College of Medicine 1996 and currently is our president in the Philippine Infectious Diseases Society for OBGYN and also serves as the vice president for another society, AUGIN. She's the division chief of our section of infectious diseases at the Department of OBGYN in the Philippine General Hospital and also Manila Doctors. She's an active member of the academe and various organizations and is a clinical associate professor of the UP College of Medicine. So everyone, please welcome my batchmate, the ninang of my daughter, and our Wonder Woman in the Department of OB, Sybil LIzanne Bravo of the Mu Sigma Phi Sorority Batch 1997.
Thank you very much, Angel Bandola. And of course, our CSES, naku, mahirap pong sundan si Sis Nina Berba, but I'll try my best po. Ayan. So let me share my slide. The topic given to me is about vaccination in pregnancy and breastfeeding. And this are our learning objectives. So na-mention po ito ni Sis Nina na vaccines are very, very safe even when given during pregnancy. So the benefit would always outweigh the risk. And of course, we have decades of experience that prove that vaccines are indeed safe to be given among pregnant women, because there is much evidence that antibodies will cross the placenta, and somehow these antibodies will give temporary protection to the newborn baby, no? Until by themselves, pagdating nila ng mga 3 months or 6 months of age, they will be given their own vaccine. So we have our routine vaccines that are given in pregnancy. So we are very familiar with giving our pregnant women the tetanus toxoid or the tetanus diphtheria pertussis preparation, the Hep vaccine, and of course, the flu vaccine. So available na po yung influenza 2022 vaccine, no, for our use. And for selected women, we can also give mga special vaccines like pneumococcal vaccine and others, which I'll discuss shortly. And as much as we advise, no, our pregnant women na wag na po magta-travel, especially during this time of COVID pandemic, so that of course they will not contract no different infections or diseases. Sometimes it's really unavoidable, especially now that we are in alert level 1, medyo free na po tayo. Some of our pregnant women no, still would want to travel. And as such, there are also vaccines that are intended to be given when travel is not, or rather is imminent. So again, let me just emphasize, sasabi nga po ni Sis Nina na we have to get all the opportunities no, to vaccinate our patients or their families. So in pregnancy naman po, no, we see it as a very good opportune time to offer different vaccines. So antenatal period, of course, is the best time to remind them of their vaccines or lack of thereof. Yung postpartum, pag nanganak na po sila, no, we can also give them the follow-up doses, remind them of what they're lacking. And of course, we also remind them that vaccination of their whole family is of utmost importance. So now, we also tell them that hindi lang naman bakuna ang way not to prevent from getting diseases, but of course, we still have to remind them about primary hygiene, especially during this time of pandemic. Aware naman ng mga natin, ng kababayan about the health protocols. So, ganun pa rin, minimize exposure to infected people. We still have to, of course, wear our mask, or in healthcare institutions, no, sometimes we still have to wear our face shields. And of course, as much as possible, again, advise them to avoid travel to endemic areas. So now we go to the recommended vaccines during pregnancy and later during breastfeeding. Itong top 3 are influenza, the Tdap, ito po yung mention against tetanus pertussis, and of course, hepatitis A. They're just so-called special recommendations. So pwede itong mga vaccine na to be given when our pregnant women are at risk of contracting these diseases. And during travel naman, pwede rin i-offer itong meningococcal and rabies vaccines. But of course, the live vaccines are all contraindicated to be given when pregnant. And additionally, no, during travel, depending on the area that they're going to, kung di talaga ma-avoid when one of these diseases is endemic in that area, then and the vaccine is available, then we have to offer that particular vaccine. Now, moving on with the recommended vaccines. Now we have the flu vaccine. As I've mentioned, the 2022 flu shot is now well available, yung 2 brands po. We have known that influenza, no, during pregnancy causes lots of morbidity and high mortality. In fact, there is yung 10 years ago, no, a decade ago, we have heard of the SARS flu, yung MERS-CoV, and other influenza pandemic that time. It has affected much of pregnant women that has resulted in, of course, ICU admission, preterm birth, having low birth weight babies, and of course, increase in mortality. And as such, of course, we need to prevent this, no? Kaya we need to actively, no, encourage our healthcare providers, hindi lang tayo mga doktor, pati mga nurses and barangay healthcare workers who are trained in offering antenatal services to please offer and give the flu vaccine to our pregnant individuals. Ang recommendation is not just to give it past the second trimester or first trimester. We can safely give no flu shot even during the first trimester. Now moving on with the second vaccine is tetanus. Um, well, we'd like to deliver the good news that tetanus has actually been not really eradicated, but our government and together with all the medical societies, we have been successful in reducing morbidity and mortality due to tetanus. And that would include advantages to the pregnant woman and her unborn fetus because of vaccination. Ayan. And of course, hygienic practices. So dati po, it has resulted in much, again, morbidity and mortality resulting to death no, of the pregnant woman and her fetus. And of course, it has also affected no, neonates. So there has also been increase in neonatal morbidity and mortality due to this infection. But again, with the efforts of our government and all the medical societies, we have been very active in offering the tetanus vaccine no, to our pregnant women and the general population such that we have brought down the yung mga morbid numbers no to well mababa na po, mababa na yun ang ating incidence to significantly low incidence of morbidity and mortality due to tetanus. Okay, so our pregnant women again are indeed no special population that we should offer the tetanus toxoid vaccination. They should receive at least 3 doses of the tetanus toxoid vaccine. The first 2 doses to be given 1 month apart, and yung third pa rin, ganun pa rin naman, we follow the 016 regimen. 1 dose of which should be given as the Tdap. So ito po yung polyvalent vaccine that would include protection against diphtheria and pertussis. So mas maganda itaon natin na we give the Tdap as second dose. Sana tatama siya during the third trimester between the 27 to 36 week age of gestation. Okay. Now moving on with diphtheria, as was mentioned by Sis Nina, there has been again no increased morbidity and mortality due to this infection. For pregnant women, it has also resulted to increased death. No, so pregnant women who acquire diphtheria have, of course, difficulty of breathing, and that would again no, cause pneumonia and sepsis, and that would again increase admission to ICU, preterm birth, having low birth weight babies, and of course, increased maternal mortality and fetal and neonatal morbidity and mortality. And as such, we again recommend vaccination during pregnancy in the form of the polyvalent, trivalent Tdap. So we are very lucky that in our generation, we have now this Tdap vaccine that we can safely give to our pregnant women. So as I've mentioned, we can give the first dose at any elected date in the second trimester to be followed by, preferably po, no, yung second dose, we give this as Tdap. Pwedeng second dose or third dose depending on the availability, but the Tdap is well available now in our setting. And of course, we still have to complete the series by giving the third shot either as a tetanus toxoid or Tdap kung hindi siya yung naging second dose. Now moving on, Hep B, we know that Philippines, our country, is very endemic no, for Hep B. I think that and the rate of infection, the prevalence is 17% in the general population. So napakataas po nun compared to other countries. And of course, during pregnancy, it results to vertical transmission among unvaccinated individuals if they do get the infection. But for women who are already vaccinated no before getting pregnant and they have high risk exposure, of course, then the efficacy of the vaccine is about 80 to 85%. So most of the time, they will not acquire the infection. So dun sa mga hindi pa nababakunahan po, it's again, as I mentioned earlier, the antenatal period, no, when you're giving the prenatal care to your pregnant women, is a very good time to offer the Hep B vaccine, such that screening for Hep B and the anti-HBs vaccine is part no, of antenatal laboratory workup. So pag negative yung ating pregnant women's for anti-HBs, then and of course it's negative for the antigen and the antibody, then we have to offer the Hep B vaccine. Okay, so again, pregnancy is not a contraindication to vaccination. We still infrequently receive calls or referrals now asking us if Hep B vaccine is indeed safe to be given to pregnant women. So the answer is always yes, 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 yes. Safe po ang Hep B sa ating mga pregnant individuals. Ito na po yung mga with special recommendations. As I've mentioned, if the woman would be at risk, no, or if her travel is unavoidable to that area which is endemic for a particular infection, at meron namang available na vaccine, we should actively offer and give that vaccine. So, kunyari magta-travel siya sa isang area wherein there is ongoing Hep A infection, then it's prudent that we offer her the Hep A vaccine. How about pneumococcal disease, no? Again, we are very lucky that we have the availability of the pneumococcal vaccine. Well, the safety of the vaccine has not been proven, no, when we give it during the first trimester. But if there's really the need to give the pneumococcal vaccine to our pregnant women, we start giving it at the second trimester. Okay, so for unvaccinated women who are a high-risk group, we give usually the more polyvalent, the polysaccharide 23 pneumo vaccine. So moving on, this is the last part of my lecture, the COVID-19 vaccine. So parang umay na po tayo, and we have delivered this topic in various lectures or seminars or webinars, but still, medyo under vaccinated pa rin po ang ating pregnant individuals. Well, in PGH, maganda naman ang ating vaccination rate among our pregnant women, mga 60 to 70%. Mataas na po yun, but we want still to, of course, vaccinate as much as pregnant women, no, that we have on at our clinics and at the OPD. So again, I'd like to reiterate, COVID vaccination is recommended for all pregnant women. There are no existing evidences of any adverse maternal or fetal outcomes from this vaccine. So again, all of the vaccines are safe except lang po yung Sputnik kasi siya lang yung walang study on pregnant women. Pero regarding availability, wala na rin pong Sputnik kasi ngayon, no? Lalo na ngayon with the ongoing war, no, between Ukraine and Russia. So how about among our breastfeeding women? Yes, we give the vaccine to breastfeeding women. Again, the benefits, no, are shown have been very overwhelming. The antibodies are transferred to the breast milk, and when the suckling infant gets it through breast milk, then the infant is at least protected for 3 to 6 months from COVID. For booster shots, again, we highly recommend the booster shots to be given to our pregnant women as well as our breastfeeding women. Now, moving on to the last vaccine. How about HPV vaccination? Kaya ito po ay medyo red yung color kasi ito lang muna yung vaccine na hindi pa natin binibigay sa ating mga pregnant women. But as an update, gusto ko lang po i-share, no, during the postpartum period, we could actually practically give any vaccine naman to our postpartum or post-delivery women. So, ang update lang naman po dito, the Gardasil 9, the non-availant vaccine, has now the additional indication of preventing head and neck cancers. Ayan. Okay? So again, as a review, these are the vaccines that are routinely given to our pregnant individuals, the influenza shot, Tdap, and Hep B. And we have special recommendations for the following vaccines and for travel. And of course, all our live vaccines are not yet offered to our pregnant women. For those in the postpartum period, as I've mentioned, all vaccines can practically be given. Kung meron silang kailangang catch-up shots or vaccination, please do give this. And even the anti-HPV vaccine are safe for breastfeeding as well as the pneumococcal vaccines and all the COVID vaccines. Ito po, summarize ko na lang, na-mention naman po na ito ni Doktora-Berba. Although these myths and facts are related to pregnancy and breastfeeding. So sa ating mga buntis, yung number one myth, no, pagbuntis, bawal uminom ng gamot, bawal na bakunahan. But we have shown overwhelming evidence that there are very, very few adverse reactions, usually mga local site reactions lang po ng vaccine during pregnancy. But the benefits are, of course, a multitude. Vaccination can cause infertility. Of course, this is not true. yung sa tetanus toxoid po, yun yung na-chismis before. Kaya lang, sabi nga natin, to avoid such coincidental occurrences with spontaneous abortion and giving the tetanus toxoid vaccine or even the tetanus diphtheria toxoid vaccine, we just avoid giving it during the first trimester. But all the other vaccines can safely be given even during the first trimester, including the COVID vaccines. So again, vaccines are not tagged with miscarriages. Vaccines definitely do not cause autism. In fact, natanggalan nga po ng license yung doctor, no British doctor, who published the article relating vaccines with autism. And again, we have overwhelming evidence that vaccines do not cause autism. Vaccines contain unsafe toxins. Of course, they do not. People have concerns over yung mga preservative, no, yung formaldehyde, mercury, or even aluminum. While it's true that these chemicals or preservatives might be, of course, are toxic, no, when given in substantial amount. When used as preservatives, they're in very, very minute concentration, and as such, they do not cause toxicity. Okay? So again, this is the last of my slides. We have now, as I reiterate, the Immunity app updates. You can download this app for your tracking. Thank you very much for listening. Good day.
Thank you, Sybil, for that very interesting talk. A lot of questions have come up in terms of pregnant and lactating women. Now, it's very good, to remind each other about the importance of vaccination, not only for ourselves, but also for our loved ones. I know everyone's excited to ask questions to our speakers, but let's now hear from our esteemed reactor, to also give some insights on today's talks. We are so lucky to have with us here today Ms. Joko Magalong-De Veyra. Ms. Joko is the president of Transnational Services Incorporated, an overseas recruitment company in the Middle East, US, Europe, and the director of the MS Magalong Management Inc., which is a property management firm. In her free time, she also serves as a voiceover artist and feature writer to several institutions. She also gives trainings on leadership, presentation, business storytelling, vision setting, and customer service. So everyone, let's all welcome Ms. Joko Magalong-De Veyra.
Thank you so much. Thank you so much for that, Doktora. Thank you very much. Thank you to our esteemed speakers as well, Doktora-Berba and Doktora Bravo. I'm privileged to be your reactor for today's webinar. So my initial thought as I was actually listening to the talks was that I wish I had this when I was younger. I would have loved to have attended a webinar such as this. This should be part of health education. Like, more women should know how to take care of themselves, including the immunizations that they would need to protect themselves and their children as well. As Dr. Berba said, it starts when we're younger, to when we are seniors, right? And I wish I knew that. I wish I knew about the women's vaccination tracker. I wish we had that when I was growing up. I actually received the HPV vaccine about 10 years ago. And the only reason I was doing that, I was able to do that because I was going to my OB-GYN because I had PCOS. But if I didn't know that, and I thank God for my OB-GYN who actually told me to get that HPV vaccine, because after this talk, I realized how important it is. And it's something that a lot of the women out there should understand as well. In this current time that we actually live in, fake news abound, and it's so easy to believe all the myths and the rumors that actually Dr. Berba and Dr. Bravo actually all debunked. But as Dr. Berba's talk actually espoused and emphasized, vaccines not only benefit the individual, but the country as well. And there are other vaccines besides the COVID-19 vaccines that are equally important to take care of ourselves as women, as well as our children if we are currently gestating them and we are pregnant, right? Besides the COVID-19, we have vaccines such as the chickenpox, the shingles vaccine, which I've known about shingles, but I didn't know that there was a vaccine. So that was the first time I knew that today. Diphtheria, tetanus, hepatitis B. I didn't know that there's also a vaccine that would potentially also protect me from the cancer of the liver, which I think is good news for everyone as well. PV, influenza, pneumonia vaccines, the two kinds that was discussed, and others as well. And someone who has had COVID and whose family was actually hit by COVID-19 pandemic early on, it was actually really terrible to hear that story about someone thinking to boost the family's immunity by infecting their loved ones to grant them immunity. So I hope nobody that is watching this would even or think that way. From Dr. Bravo's talk, it was really eye-opening for me. I've never been pregnant, so this was all new to me. And I don't know where I had the misconception that pregnant women shouldn't take medicines. Therefore, in my head, that kind of translated to pregnant women not being able to take vaccines, but I guess that has been debunked. And so remember the routine things that we should have, as Dr. Bravo mentioned, Tdap, Hep B, flu vaccine as well, and the other vaccines that might help you if you're going to a certain place, or you're traveling to a certain place. It's empowering to know that vaccines are a way for us to protect ourselves proactively, and it is something that a lot of us should avail of. And I have with majority of the things that you said, I actually have most of them, so I'm glad. Good job to my doctors as well. And it's actually very good when it actually said that COVID-19 and pregnancy, all vaccines are safe except for that particular vaccine. And to end my reaction to this, I want to commend everyone and everything that you've been doing to forward this this thought of empowering women to get vaccinated. And lastly, while information is indeed needed to and empowering for us women to know, it's also really a question of a cost as well. So I was very pleased when it was mentioned that the Philippines actually has this vaccination program that has been working, and it's good to know that that is so, because as Dr. Bravo actually said in her talk, cost should not be a consideration, because at the end of the day, the cost of the vaccine would definitely be less than the cost of managing the disease or fighting the disease. And we're not even sure if we are able to fight the disease given our own immunities and our own statuses in life. So I enjoyed this talk. Thank you very much for having me as a reactor. And I'm sure that I, together with a lot of people who are watching here, definitely gleaned a lot of key messages from both our doctors. And if I would be able to ask just two questions, one question would be for Dr. Berba. Is it actually true that the more side effects that you have to a certain vaccine, that means the stronger your immune system is? Because that was told to me when I was getting the COVID vaccine. And for Dr. Bravo, any updates on the COVID vaccine with its effects to fertility as well? And I thank you all for having me, and I look forward to answers to my questions as well. Back to you, moderator.
Okay, Dr. Berba, maybe thank you, Joko, for for encapsulating everything. No, it's very, very important for us to realize that knowledge is really empowering, and we hope that this webinar will drive people to avail of their vaccines. So we'll thank you also for the segue into the question and answer portion. So Dr. Berba, do you have any answers for Ms. Joko about her question on reactogenicity and its efficacy? Yeah.
So, Ms. Joko, parang hindi naman nagko-correlate distinctly, no? So, like, proportional, the more you have reactions, the stronger your immune system is. No naman. But it does tell us na pag nagka-reaction, parang kiniliti, na-tickle mo yung immune system mo. So, there's some response. But this is not to say that those who did not have any reactions didn't have any immune response also. So there's no correlation kasi dun sa degree of what you felt. In addition kasi the threshold for feeling that you felt something after the vaccine was given to you is very, very variable then. So no, it's not definitely true. But sometimes with the COVID, di ba, parang na-sense ng mga tao, mas mabuti nga na meron ako naging reaction. In general, pag ikaw yung doktor, ayaw mo na nagkaka-reaction yung mga patients na you gave vaccines to. The less reactions, the better. So, but it doesn't correlate to the immune response.
Okay, we'll now move on to Sybil about the effect of the COVID vaccine on fertility.
As of now, many studies, some few studies have shown that there is no effect of the COVID vaccine on fertility. In fact, if pregnant women, when women of reproductive age do get pregnant and they have the infection COVID, yun ang masama, no? They undergo spontaneous abortion or they suffer from preterm birth. So that's pregnancy loss. Pero in itself, the COVID vaccines have not been proven to affect fertility.
Okay, great. Thank you very much, Joko, for joining us this afternoon. I know that you have another engagement, so thank you. We'll proceed with the question and answer portion. Maybe we can have a picture taken with Joko first before we, let's have the team take a picture. Okay, all right. So we'll now proceed to the questions from the floor. And there are a lot of interesting questions. But to start off, for Dr. Berba, so now that women are convinced that they need to get updated with their vaccines, which doctor should they look for? Parang sino ang pwede nilang puntahan para makakuha ng bakuna nila?
So to your regular doctor, or to any internist, family physician, ang the best is your usual doctor kasi siya na yung may pinakakilala sa'yo. So if it turns out to be your obstetrician, that's fine. They could as easily give these vaccines as looking for a new internist. Minsan mahirap yung maghanap ka pa ng new doctor. So your usual doctor is the best choice.
So lalo na ngayon during the COVID pandemic, maraming naging more acceptable to getting vaccines, no, especially for the adults. Dati ang thinking lang mga bata lang yung kailangan ng bakuna. Ngayon, talagang nakikita natin and a very good opportunity to push our advocacy for adult immunization. For Dr. Bravo, we have a question here in the question and answer box. Is there any study about vaccine reactions concerning with COVID-19 to regular flu vac, COVID-19 to Tdap, COVID to Hep B? If there is such a study, please enlighten us on this result. And how long is the interval between COVID-19 vaccine versus other vaccines?
Okay. There have been multiple studies regarding the side effects of these recommended vaccines in pregnancy, but these studies have shown that the most common adverse events were related to local site reactions, such as, of course, yung pain, lahat naman ng may needle talagang masakit, may erythema, pamumula, and some might have yung tinatawag na pangangalay, yung malay, but these have actually no direct effects on the pregnancy. So again, these vaccines just generate itong mga local site reactions. If ever yung systemic lang naman, there could be sometimes malay and slight fever, but these do not really affect the pregnancy. And again, these vaccines are not teratogenic. For the COVID vaccine, ganun din naman po, no? Meron na rin studies on the effects on pregnant women. Again, they're very, very safe. Mas mataas ang benefits than the adverse effects, which are, again, local site reactions lang po. Yun, pain, erythema, may pangangalay, yun lang.
And what about the interval between vaccines? After receiving the COVID vaccine, how soon after can you get your other indicated vaccines during pregnancy, or can you give them simultaneously?
From the CDC guidelines, and in-advocate na rin natin sa POGS, our society, and sila Ma'am Nina din, no? There's no recommended interval na nga eh. We could simultaneously give the vaccine with any of the recommended vaccines during pregnancy. So they are proven to be safe. Yung nga lang po for us healthcare workers and our pregnant women, we usually have to give a recommendation letter to our pregnant women para mapagbigyan sila sa DOH vaccination site. At they have a special line, hindi na sila pipila, together with the healthcare workers and the senior citizens. They have a special line. So magbibigay lang tayo ng recommendation letter for COVID vaccination.
Okay, great. So aside from COVID, syempre, so for Dr. Berba, is if somebody has already had shingles, is there still benefit in getting the vaccine?
Oo. Sa recommendation, if you didn't get the vaccine before, it's still recommended. Pero siguro, in real life, parang hindi pa naman ako talaga nakakita ng 2 beses siya nagka-shingles over a span of like several years. So most people won't do that anymore. But the recommendation would say that yes, go ahead and still give kahit nagka-shingles na before.
Okay, okay. Sige, let me look up kung meron pang newer questions. Ayan. Sige, for Dr. Bravo, um, sino ba? How would you encourage pregnant women to get vaccinated? I mean, what's the most important factor in addressing vaccine hesitancy for our specialty?
Okay. During prenatal check-up, no, ito nga yung opportunistic time for us to offer these vaccines. So we start with telling them that the studies probably, no, we can summarize na very, very safe to mga recommended vaccines, including the COVID vaccine, no, to be given during pregnancy. It will not only just benefit them, no, but as well as their unborn children. There is transfer of maternal antibodies through the placenta. And for a time, mga 3 to 6 months after birth, these antibodies no will still protect no her neonate. Plus the fact that if she gets a vaccine, of course, it will prevent her from having preterm birth or spontaneous abortion and all the morbidities associated with that particular infection. Plus, of course, we also encourage her to get the vaccine to protect also the other members of her family, especially kung very, very high risk siya. So, talagang we really have to, be very, very generous no in giving advice to our patients. Huwag tayo magmamadali kasi nakita ko sa ibang mga experience, nagmamadali ang healthcare workers, especially mga OB in seeing their patients. Minsan baka wala lang time no, to explain all the benefits. But of course, kailangan pa rin naman nating sabihin na there might be side effects, yun nga po yung mga local site reactions, no? And when they do have them, just report to us para
Yeah.
at i-ready natin sila if ever for the potential side effects.
Yeah,
What to do.
I think very important motivating tool is to communicate to them the importance of preventing the infection sa kanila and passing on antibodies to their unborn child. Even protection for their family. And I think we've accomplished a lot over the past years about advocating vaccination for pregnant women. Okay, so this is the burning question that must be asked. Dr. Berba, based on the recent count, are we reaching herd immunity for SARS-CoV-2? And what are your thoughts on the second booster for COVID?
Okay. So, sa audience, actually meron kaming ginagawang study sa PGH na we tried to monitor everybody, no? Everybody. We're close to like 6,000 people in the hospital. So, we monitored those who were vaccinated, who weren't vaccinated. At saka we had funding for antibody levels. Side comment ko lang, hindi ibig sabihin mag-antibody levels tayo lahat. So that's for research purposes. And what we really did see is parang bumababa yung antibodies over time. So the boosters are really a good recommendation. I think ito yung nag-define kung bakit we are where we are right now. We're sort of like in a really safe stage right now, 'di ba? Ang bababa ng incidence ng COVID-19. And I think it really has to do with many people getting fully vaccinated at saka boosted. The count is like something like 59%. Yun yung sinasabi ng DOH eh. But you do feel that there was some amount of herd immunity already, diba? Kasi most of us hindi na nagkakasakit at this time. The target was 70%. But I think even if we just met close to 60%. This is where we are right now is really, really much, much different. And we're in a safer place right now. So if kung nasa herd immunity na tayo, I think partly yes, pero I think kung magpa-booster yung mga hindi pa nagpapa-booster, the immunity of the whole population will even be stronger. So, para lang pakita ko sa inyo, kung yung mga levels kasi nung antibodies, 'di ba? Iba-iba yung na-receive nating vaccines. So, sobrang yung iba maliliit, yung iba mararami. So, very variable. But when we measured the antibody levels of those who received the booster, parang it didn't matter anymore. Lahat sila tumaas to a very high level. So, kung kayo hindi pa nagpapa-booster, I suggest magpa-booster na kayo talaga at this point in time. About the next boosters, I think malapit ng mag-release yung vaccine experts panel. They're just maybe wrapping up their recommendations, but I agree with them also na after a few months, sabi kasi sa most studies mga 4 to 6 months kailangan na tayo magpa-booster. So maybe we're around that time already. So expect na magkaka-recommendations from the Department of Health.
We shall eagerly await that recommendation kasi it's a very contentious issue, no? I think one of our focus now is really to make sure that majority of the population gets their first booster kasi medyo naglalag pa tayo doon, no? But yeah. So Sybil, there's a question here. Pwede po ba ang vaccine sa kababaihan para sa transgender?
Of course.
Yeah.
Transgender meaning. Kasi naman ang vaccination is for all types of people and all gender types. Yes, of course, pwedeng-pwede, including the HPV vaccine because if syempre transgender will be sexually active, so it's best also to give this SA vaccines, Hep B and the HPV vaccine to our transgender population. Actually, in some countries like in Australia, nga libre ng HPV vaccine even among the transgender population.
Mm-mm. Tapos, if completed na ang Tdap prior to pregnancy, do we still need to give a dose during that particular pregnancy?
Yes, hindi ko na yun na-mention kasi nga na-hide ko na yun sa slides ko. The answer is yes. Even if you receive a Tdap dose in your previous pregnancy, let's say buntis ka ng 2021, nanganak ka na, then ngayon buntis ka ulit 2022, you still have to get Tdap vaccine, one dose during this current pregnancy because studies have shown that the antibodies against diphtheria and pertussis, especially to pertussis, are waning within 6 months. So kung buntis ka ulit ngayon, you have to get another dose of Tdap.
Great, yes. And it should be around the time, at least like 27 weeks onward. So you'll get maximum antibody titers by the time the patient gives birth. We have a...
Regarding that, yung timing of giving the Tdap is starting at 27th week. So medyo mid-third trimester is for adequate placental antibody transfer. Ayan. Not too early, not too late, but starting 27th week, pwede na po.
Yeah. So we have a question from our professor, Dr. Ana Marie Madamba Burgos. Some of my patients do not want the booster since they said their immunity is better since they had Omicron already. How can we convince them to get their booster dose? Dr. Berba and Dr. Bravo.
Pero meron talagang totoo rin yun. We also saw that when they had natural infection, yung natural immunity is also strong. And di ba, there was a New England Journal of Medicine article very recently released na parang very sturdy yung natural immunity. We used to think na 90 days tapos wala na erase na yung immunity. But it looks like it's more persistent. So my take on that is we just really say na for persons who have a mix of antibodies both from a previous vaccination and a previous infection sometime in the future, kasi syempre very variable din yung mga iba-ibang tao sa community, pwedeng bumaba yun eh. And we have no way, unless we test everybody, we have no way of predicting who will and who won't have lower levels than what we target them to. So, yan. The only way is to just get the booster at the specific timing relative to the previous schedules you had.
Okay. Sybil, you have any insights on that?
I agree 100% with Doktora Berba. So it's just yun nga, taking really enough time with each of your patients, yun lang naman to fully explain the benefits of the booster shots. Yun. So pwede tayo mag-cite ng mga nangyayari sa ibang, yun, ng mga ibang patients who had the infection and yet they were reinfected. Ayan. Or yung mga nabakunahan na, pwede pa rin talagang magka-infect. Or they can still get the infection. And as such, there's really use of the booster shots. May tanong ako kay Ma'am Nina, if okay lang po, short question. Ma'am Nina, are there studies on the function of the memory cells po in generating antibodies against COVID, if ever po after primary immunization with the primary series of the COVID booster?
Actually, I think hindi pa clearly defined kung ano nga bang cell yung pinaka determining factor or really drives the immunity. We just say the immune system in general. Pero let's say we measure the T cell or the IgG, yung mga iba-ibang we think are parts of the immune system, parang minsan they didn't have a clear trend. So parang globally, all the experts would say, basta may response, but kung ano yung clear-cut, objective quantity, at saka ano siya, hindi pa yun clearly defined. So we don't. We're still in the discovery and exploration phase. We're still trying to understand this COVID-19 and the human response to it.
That's true. And, I think our country has benefited a lot from the vaccination. No? I mean, it was a very laudable effort. Of course, it was a bit delayed, but eventually, yun nga, we're reaping really benefits from this. And yun, I'd like to ask, I think we have time for one more question. So, which among these vaccines are important for young adult patients? So kunwari, tatanungin tayo, ano bang uunahin ko in terms of prioritization? Which would be your recommendation?
What do you mean? The pre-pandemic vaccines, yung ganun?
Ako, yeah.
Ako, let's say I have a patient. Let's say I have an HIV patient, so immunocompromised siya. Tapos tatanong niya sa akin, ano ba pinakamahalaga sa lahat na to? So while we are in a pandemic, I will prioritize and tell him, sige, COVID-19 muna, concentrate ka on getting your first dose, your second dose, and then your booster. In between, I will try to give him his flu shot and his pneumonia shots. Yan. We think most of the people actually had some hepatitis B, yung mga tetanus Tdaps nila, tsaka yung mga MMR, they probably received them as during the childhood phase.
Mm-mm. Yeah, kasi another question was, what if they've never received a vaccine at all? So, Sibs, kunwari they go to our clinic, young adult patients, what in what order would you recommend they get their vaccines?
Siguro sa akin in the context of yung mga young women in their reproductive age about to plan for pregnancy or to get married in the future. Para din kay Ma'am Nina, syempre unahin natin yung kung ano yung pinakamadaling mahawa. Of course, is COVID as of now. So COVID vaccine, sa kalibre yun no? Wala silang effort, mag-register lang. To be followed by the flu shot. Marami po nag-o-offer ng mga centers ng libreng flu vaccine. And of course, ayan, to be followed na by yung mga STI vaccines, although medyo costly, Hep B and Gardasil, HPV vaccine. Ayan, kasi ito yung mga STI vaccines, no, that are very, very useful for our young reproductive age women, pati sa males din naman eh. And kung may risk factor yung pneumonia vaccine, meron din po murang pneumonia vaccine. Very, very useful. Ayan.
Yeah. I think, yeah, for preconception and patients who are just about to start their sexual debut, yung parang really prioritize protecting yourselves against sexually transmitted infections like HPV and Hep B. And then for preconception, and we're getting a lot of consultations for this as well. So like the rubella, we have to check their titers.
MMR pala yan. MMR
Yeah.
vaccine, I forgot.
It's really, really devastating if they get the infection during pregnancy. So let me see. I think this wraps up our question and answer portion. Thank you very much to our speakers. Very enlightening to wrap things up. Of course, our takeaways are vaccine saves lives. It prevents disease. It will protect you, your unborn child, the family around you. And adults also need to get their vaccines. Doctors are available to give you more information. This webinar has been very, very helpful and enlightening. And I'm sure we've been able to clarify some myths and misconceptions. Do you have any last words, Dr. Berba, and to follow Dr. Bravo? Nakamute po kayo, ma'am. Thank you.
Sorry. Yun nga, an ounce of protection is like a pound of cure and good health. So like try to just devote a little bit of time, effort, and maybe a little bit of funds, no, for you to get to the clinics and get your vaccines. So that will help not only you, but your family, your community, the country, and the whole world.
Thank you. Sib?
Ayan. For our preconceptional women, ayan, meron tayong mga kabataan dito. Get yourself vaccinated, of course, and MMR and all the recommended shots, including the COVID vaccine. And during pregnancy, no, don't be afraid. Yan, ask your doctors, ask your obstetrician gynecologist which vaccines are recommended to be given to benefit you and, of course, your unborn child and your family.
Okay. So thank you very much. And again, our sincere gratitude to all of you for giving everyone an informative overview of our topic today. So before we end, we, the MU webinar team of the Mu Sigma Phi sorority, would like to express our gratitude to our partners. The UP College of Medicine, the Philippine General Hospital, the City of Manila, and this event would not be possible without our co-presenters in Life Sheroes and the Mu Sigma Phi Foundation, and our official media partner, Our Awesome Planet. We are also grateful for the unwavering support of the UP Manila Information Management Systems and the UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. Again, we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form at tinyurl.com/MUwebinars2021eval within 3 days after the forum. You may find the links to the evaluation forms at the comment boxes of FB Live, YouTube, and chat box of Zoom. In celebration of the World Immunization Week 2022 with the theme Long Life for All, we would like to invite you to our upcoming webinar entitled Immunity, a Passport to Longevity, which will focus on the relevance of immunization through the ages and for all ages. Join us on April 28, 2022 on Thursday from 5 to 7 p.m. via Zoom with our esteemed speakers, Dr. Melvin Sanicas, Dr. Lulu Bravo, and Dr. Beverly Ho, which will be moderated by Dr. Wen Del Rosario Raimundo. We would also like to invite you to be with us on the next leg of the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on May 10, 2022, Tuesday, from 12 to 1 p.m. entitled Public Cervix Announcement, a forum on cervical cancer or cancer sa kwelyo. Ano nga ba ito? which aims to give us an overview of cervical cancer, its risk factors, signs and symptoms, diagnostic options, and treatment and prevention. For this webinar, we will be having Dr. Concepcion Rayel, Dr. Merlin Montenola Morales as our speakers, and Ms. Reese Rayos as our reactor. This will be moderated by Dr. Glady Maura Facun. And likewise, please support and participate in our year-long Women's Health Forum series. And these are the dates. Please check and see if there's an interesting topic that you would like to attend. Thank you very much and have a good day.
Thank you for attending the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The MU webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation. And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MUwebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at muwebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on May 10, 2022, Tuesday from 12 to 1 p.m., entitled Public Cervix Announcement, a forum on cervical cancer or cancer sa kuwelyo. Ano nga ba ito? Which will discuss the prevalence, risk factors, signs and symptoms, diagnostic options, and treatment and prevention of cervical cancer. For this webinar, we will be having Dr. Concepcion D. Rayel and Dr. Merlin M. Montenola Morales as our speakers, and it will be moderated by Dr. Gladimara G. Facun. And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good day.
Thank you po, ma'am, for the high-yield lectures po.
Thank you po. Congratulations po and thank you po so much for your time.
Hi, hello. Sorry, ngayon lang ako ngayon lang ako Kasi
Sobrang
12 noon
kapag
kami
naman
natapos
po.
sa meeting eh. So, ayan, ngayon nandito na ako sa clinic. Galing.
Galing na, Jean.
Yeah. O, ito mo well, Mu ito Mu ano to?
Ay,
It's
okay
the Mu
yan.
PPE. Hinahanap ko pa hanggang ngayon kung meron pero wala na.
Oh.
Gawa na
Okay na.
Ha?
Parang kailangan na tayo magka-jacket na pink. Wala ba tayong ganun?
Ito PPE ito.
Ayoko na ng PPE, malapit na matapos eh.
Yeah,
Ito,
Mu
jacket
jacket
ko.
na pink.
Jacket.
Pink jacket.
Ito, neon pink.
Grabe, hindi ka mawawala dyan sa Medical Plaza Makati. Kitang-kita everywhere. So happy.
Tumigil nga ako dito sa lobby kasi mawawalan ako ng signal pag umakyat ako.
Okay, ang daming questions. Nice naman. Congrats, Sybil and Ma'am Nina.
Last two na. Ang
Talaga ba? Last two
duet
na.
ng new series na to.
Oo,
May
bilis
and
din,
June, that's two.
Mga
Okay, thank you.
talaga kayo.
Oh,
Oo nga,
photo
Heroes. Heroes of COVID. Si Ma'am Nina at si Sybil.
Oo nga.
Walang kapaguran.
Oo nga. Oo. Oh, habang nandito tayo, mag-photo tayo.
Photo op na.
Photo
Yes,
op.
ma'am. I'll take the picture po.
Thank you.
Thank you po
Sige.
again, ma'am.
Oh, hindi ka
Wala
pa
akong
gumilang. Ikaw talaga. Ay, bilang ka naman.
Ayan po. I'll take a picture po.
Thank you.
1, 2, smile. Okay. Done na, ma'am. Thank you po.
Thank you sa ating mga
Thank
undergrad
you.
students.
Oo, thank
The best
you.
kayo
Yeah.
lahat. Grabe.
Great.
Okay,
Sybil,
bye-bye.
PGH
Happy
ka ba?
wedding po.
Ano
Bye-bye.
yun?
Sybil,
Ano yun, Angel? Ano yun,
Sybil,
Angel?
I
magpi-PGH
go na.
area ka ba?
Ano yun?
Are you gonna be in this PGH area also, Lilibet, later?
Ah, mamaya. Mamaya pa.
Well, if you other, I'm gonna have my men's session eh. I'll be in Manila.
Oh, sige, I'll text you. Ano
Next
waiting.
bye!
Bye-bye.
Bye.
Thank you,
Bye-bye.
guys.
Bye po.
Thank you
Bye-bye.
so much. Bye-bye. Nina, bye-bye.
Thank you, ma'am. Bye-bye po.
Bye, Ivy!
Hi, Ivy. Salamat, Ivy.